Hey there, everyone. My name is Tyler Thayer, CEO of Project Heart. We're just going to wait for a few minutes while some people log on, and we confirm that we are in landscape view. So we'll wait a second, see if the peanut gallery agrees.
Still waiting for it to load.
This is our first one, so we're just making sure that everything's working well. Is it working? Looking good. I got a thumbs up. All right. So we'll get started. So I just want to introduce what we're doing here before I introduce our guest. So every month, Project Heart will be doing a live stream video. We'll definitely record it and pop it on the websites and the Facebook and YouTube as well, so that everyone can look at it. But what we want to do is we really want to bring awareness and draw attention to the need of CHD research in just our lifetime. And if we really want to achieve our mission of funding CHD research to cure CHD and to one day find a cure so that children like my son Calvin and you who are here who have children and the adults with congenital heart disease, we believe we have to bring awareness to it. And so what we want to do is help also just kind of show parents and people with CHD exactly what's going on in the industry, in research right now, what kind of things are being investigated, what research is being done, and we want to throw a spotlight on that. So we're going to be doing this every month from now on. It's going to be a regular programming, and who knows, we might even increase the frequency after we get it going and get some good feedback on that. And so our goal is to help just talk about these things, and it's going to be a very conversational discussion with a guest every month. And so if you guys kind of looking through this, say, hey, I want to know more about this, please drop a line in the comments. If you have a comment or a question while we're doing this, please drop it here. Our peanut gallery over here is going to be letting us know what's going on, what questions you have, and we will answer those questions live. And if you are after the videos live, if you want to mark some questions or say, hey, I want to know more about this, let us know. We would love to find answers for you and put it here and have a live conversation. So before we're done, or before we get going here, I wanted to introduce Dr. Tom Doyle. Tom Doyle is a cardiologist at Monroe Carroll Jr. at Vanderbilt and Children's Hospital at Vanderbilt. And he is also good friends of us and here at Project Heart and my family personally. And he has taken really good care of our son, and he has also been he was the first cardiologist to speak at one of our events, and he's been a huge proponent of Project Heart and a really great supporter. So, welcome. How are you doing?
Thanks for having me.
Absolutely. So why don't you tell me a little bit about who you are and a little bit of your background?
So I'm a pediatric cardiologist. I've been in Vanderbilt for 25 years, and I specialize in interventional cardiology, meaning working through the vasculature, through blood vessels to make things better. And I have two colleagues, Dr. Janssen and Dr. Nicholson, who the three of us are the team at Vanderbilt.
And they're great.
They are great. So we've
Great guy. And actually, I think Nicholson's going to be out here next month, so he'll be out here as well. So,
good.
Sorry to interrupt.
That's right. That's right. And that's who I am. I have 3 kids of my own, live here in the Brentwood area.
Yep. So, and I believe you won our Napa Valley trip. So you told me you would give me an update on that. So why don't we just do it live in front of millions of viewers?
I look forward to the next art auction because my wife and I, we did win the Napa Valley trip, and it was spectacular. It really was. We had a wonderful weekend. We actually brought our 2 older children with us and explored Napa and many of the vineyards. I remember the first 3 or 4.
Yeah, which ones did you get to? Did you go to Barrington?
No.
Okay.
Don't ask me names.
Oh,
I just remember the color of wines.
Okay, there you go. Yeah, well, I loved we went a couple of years ago. When was that? Before Calvin was born. Before Calvin was born. Wow, that was a long time ago. But we went during the fall, and like all the leaves on the vines, which you never would think about, but they're all like bright oranges and yellows, and it's just gorgeous. So, but I enjoyed Barrington. It had that historical kind of flair to it. So, anyways, very cool, very cool.
So at the next auction, bid high.
That's right.
Well worth it.
It's good. Well, we might have to get that one back out there. So. All right, so how did you get into the field of cardiology? So how did you end up where you are?
So I went into medical school just out of a passion for helping people, and as I went through medical training, I would walk down the hallways and who did I want to take care of? Did I want to take care of grandma and granddad, mom and dad, mom alone, the whole family? And I was always drawn to the children, love being with children. Their innocence and their resilience was just, to me, very, very inspiring. And so I said, okay, I'm going to take care of children. And so after I got into my pediatric training, I would go through the hallways and see, who do I want to take care of, and what do they have? What parts of medicine do I like most? And I loved long-term relationships. I loved the art of physical exam and being able to examine somebody and try and figure out what's going on. I loved the ability to do something immediately to make somebody better, as well as the ability to follow somebody over many years to help make them better. And when I got through all of my checklist of things that I loved, cardiology was the perfect niche. And it really has fulfilled everything I've looked for in medicine.
Very cool. Yeah, I think one of the coolest things, I think, and I don't know, you're very prone to Facebook. I see you all over the place because
I don't even have a Facebook
I know you don't even have a
page.
Facebook, but it's all the parents. They're out there, and you're like doing a push-up against the kids, and they come in, you're racing them up and down the hall to see who will win, and it's I think that just speaks to your character and who you are and how much you love to challenge the kids that are kind of growing up through this, but also kind of give them the freedom to like, you can run too, because I think sometimes you got to push yourself, because I think even though right now we're talking with about our son, so he's 4, and it's like, okay, what are we going to do? We're going to do soccer, and so we're going to put him into like a soccer clinic this fall, and so get him moving around. But I think that's one thing as parents, we're always we're one grip, and we're like, oh man, this disease is so, it can wreak havoc on you. But I think physical activity is really great for the body. I mean, is that true? Or?
It's critical, and we often, we both as medical professionals and parents, we often, when we've had a child who's been very fragile, want to protect them.
Yeah.
But our surgeon, one of our surgeons has, and I won't quote him directly, but he said, we work so hard to get you to live. Now go out and live really life. Go out, play, run hard, do things. And so I think the goal nowadays is to get children to do as much as they safely can, and not put a lot of restrictions.
Have there been any studies? We'll get a little bit of the research on that. Any articles or anything that have been published, especially in like the last maybe 10 years, that are really in backing up that notion that as you're growing up and say post-Fontan and you're doing something, get active.
I don't know of any particular studies that give you hard data to suggest that, but I think we as physicians all realize that the sedentary lifestyle is much worse, whether it's in terms of waking or deconditioning and heart health. So I think it's a natural, or it's more for us trying to remove our own protections. We always wanted to say, don't do this, you might hurt yourself, and I think we've realized over the years that protective mode may be a little bit overzealous, and we're much safer letting children run around and do things and participate in things than we may have in the past.
Yeah. So is it fair to say that a kid's body, so my son's body will kind of tell him when to slow down, and so like, hey, Calvin, go out there and kick the ball and do all the great stuff, but when you get tired, just listen and stop.
That's exactly right, and that's what I tell my parents and my patients is, go do what you can, and when you need to stop, let yourself stop. And as parents, tell the coach, my child has a medical issue, we want them to participate. Well, when my child says, I'm tired, you take it seriously. You don't tell them to do 4 more laps.
Yeah.
They get the permission to stop when they need to.
That makes sense. And honestly, I think over time you can, even if you're not pushing. I mean, I played soccer in high school and it was pretty intense, but you could get pretty fit. And I think I'm assuming that the endurance would still increase. And as a child is wanting to participate in some of these sports, that you just really have to, like anyone else, you really just have to respond to, and I guess take your time to kind of build up that endurance and work hard.
and then work with your cardiologist. The American Heart Association has recommendations, guidelines for things that they consider to be safe. But it also all depends on your level of competition that you're interested in.
True, that makes sense too. Well, cool. What do you think? So a little bit more about you. So I'll bring it back to you a little bit. But what's one of the most rewarding things about your job and what you're doing?
I think I just this afternoon was speaking to a bunch of high school students, and I was asked a similar question, and the answer was I can think of nothing greater in life than making a child better. You can make millions and millions of dollars. It'll never be enough. You can buy all this property. It'll never be enough. But to make a child better and to know that that will go on much longer than you, that effort and that child and the potential that that child then has to make a difference in the world, that to me is what makes my life rewarding, my career rewarding.
That's awesome. What about one of the most difficult things that you face in this position?
That's another question often asked, and I have not experienced it personally, but I have experienced it a lot, of the loss of a child, and I cannot imagine the pain and the heartache the family goes through. As a physician or a caregiver or a nurse, anybody working with the children, that is the hardest part for us too.
Yeah.
We love to win, we love to succeed, we expect to make everybody better, and there are times when we don't, and that's the hardest.
Honestly, I don't know how you guys did it, because even just, Eric and I were in the hospital for maybe 100 days over all Calvin surgeries, but you guys are there your entire life until you're done.
But as we often remind ourselves, we're probably going to go home tonight.
True.
And we're going to come back tomorrow, we're going to give it our all tomorrow. But there are so many parents and families and children who aren't going to go home tonight. And that's the hard part.
Well, and honestly, that's why we started Project Heart.
Yeah.
So I mean, that's the thing that we experienced in the hospital. That was here we are, and 3 kids, us in the middle, one on the right, one on the left, going through surgeries that day, and through that stint of a couple of weeks, one doesn't make it, 2 do. That is a tough reality of this disease, and it just kind of breaks your heart. So, so that's a really tough thing. But I think that's kind of why we're here. Was what we're doing. So, let's start digging into a little bit of the research. So, part of this video cast is to really what we want to do, and a lot of our listeners, readers, donors, they want to know what's going on. And honestly, there's a lot of research going on, and it gets published in a journal, and it is like over a lot of our heads. So what we want to do is take some of this and say, here's what's happening, so that people can really understand, so that our donors, that you guys out there in Facebook land, can grasp what's actually going on behind the scenes. So, but I think part of that is also we got to know kind of like what's lacking, what is up. So I guess we have gone very far. I guess if I hadn't talked about it, this is a great one. So we were at Sepsis with you guys last year, and it was awesome. But one of the topics was the Fontan. And that whole discussion about the Fontan was what I heard, part of what I heard, being a parent of a child with a Fontan, was we haven't really pushed the Fontan in like 15 years, substantially. It's changed, it's been tweaked, but the palliative care, that procedure, hasn't really changed, and there's not been something new that's kind of come in. So what are some of the things that are being recognized as we haven't pushed this in a while, and this is where people need to go, or are there rumblings of things out there that here's what we need to do?
Sure. I think the first thing we need to do is raise money.
True.
And I think not only, I think for 2 venues, I think obviously to support the research is 1 in 100 children is born with a problem with their heart.
Yeah.
That's very, very common. You go to a baseball game and there's hundreds of children in the stands of the Titans game who have a problem with their heart. Nobody knows about it because you can't tell looking at it. So the need is there. The problem is there's not enough money going to that kind of research and to training those researchers and And so those are the two areas where I think we need to really focus financially on the research itself and on people who want to do that research. The areas to me that are exciting, and there's a lot of areas that are exciting, and there's been enormous changes over the few years I've been doing it. To me, one of the most exciting areas is tissue engineering. Right now, you need a new heart valve. You call the company, they make it out of metal and plastic, and you put it in you, and it works great, but it's not yours. And that's great as an adult, but as a 2-year-old, we can't do that because that metal and plastic's not going to grow, and it's not going to work well as a 2-year-old. But boy, if we could take a blood sample from you, send it to a company, and have them grow your own heart valve, and then that company ships you a couple heart valves, and our surgeons go in and put it in. Now you have your own heart valve, and there's a 2-year-old that grows with you, and you never need another operation. So that to me is kind of cutting edge, exciting research. Another area along those lines is kind of stem cell research. The heart is an organ that doesn't regenerate itself. You have a heart attack, that muscle dies instead. You're born without a chamber, we don't have that chamber. But boy, wouldn't it be unbelievable if you recognized early in fetal development that there was something not right, there was a chamber not growing normally, and you could give a genetic promoter or activator that stimulates that heart to grow what it didn't have. Or along those lines, you're born and you have your heart's not structurally normal, but you grow that part of the heart, or even grow a whole heart genetically, and say, okay, this heart's not the one you're going to get to be a grandparent in. Let's grow your own heart in a dish, and now we take the old one out, put the new one in. Again, you've got your old complete new organ that's been genetically designed by your own body to be there.
Now, some of this is going on over
One of my partners, Dr. Baldwin, is really one of the lead researchers in tissue engineering, and I come to work every day expecting him to tell me today's the day we got the valve, we're ready to put it in. So it's going to happen. Another area that's not so much kind of research to cure a disease, but the idea of using virtual reality. In my early training, if we had a complex heart, we drew it out on a piece of paper. And we would show a parent, here's a piece of paper. I can't do it on 3 dimensions because it's a piece of paper. Nowadays, through things like Project Heart, we have virtual reality systems where you can take a very complex heart model and you can hold it in your hands and you can look at that heart, and our surgeons can look at it and say, oh, last night I went to bed thinking this is how I was going to fix this, but now looking at it in real time, 3 dimensions, I realize this is probably the better way for me to fix this. And that to me is taking this incredible technological revolution and using it to make care better. And as you're well aware, your system, you can walk inside the heart, which as a cardiologist is so unbelievably awesome that.
And it's hard to explain unless you actually get into it.
It's hard until you've been in that heart.
Yes.
You can't explain it. But that's going to help treat patients. It's going to help train the next generation of cardiologists. Today we're going to talk about this lesion. Oh, let's go inside a heart with this lesion. And there you are inside.
So just for people that might not know what he's talking about, is we're developing a virtual reality app called IDOVR that will allow cardiologists and surgeons to be able to get inside the heart. And so I was actually just yesterday had just like a little update, but a presentation of that to some colleagues down in Atlanta, actually. So the funny thing though was that conversation was the first time we'd done it virtually, to have this conversation kind of presentation of what we're doing. The interesting thing was, so I'm in the goggles, right? And so I'm looking at this heart, and I'm like, this is so great, and it's like a little underwhelming on the other side because it's streaming. They're getting a 2D version of what I'm seeing in 3D, and it's going and transmitting over the internet. So by the time they got to it, it was kind of fun because they were actually in my headset, so I could hear them, and they would just see a 2D version of what I was looking at. And they said, well, it's kind of laggy. And it was like, is it good? Like, is the hardware and the specs up? And I was like, that's a really great question. this is probably a symptom of us being hundreds of miles away over the internet. So it is like, it's one of those things. What I learned was you just don't understand how important virtual reality is until you are actually in there, and you just can't perceive. There's something with our body. So we've trained ourselves, I'm going to take this piece of paper and I'm going to draw a heart, which honestly there's some cardiologists and surgeons at Vanderbilt that we've experienced that have beautiful hearts, right? And that's one way of understanding and visualizing something. It's something that, architecture, I'm an architect by trade, we've done forever 2D drawings, right? But when you can step into something and see it in 3 dimensions, and the way you perceive it, it's not just like a 3-dimensional image, but it's mapped to your eyes so that your brain understands it as if it's actually there. It is just, it's a whole nother thing.
It's a new generation.
It is. I'm really excited about to see how that carries out in this whole discussion. So, so that's really cool. So let's talk a little bit about, how are we doing on time? We're doing good. Okay. I want to make sure. But let's talk a little bit about the genetic engineering, or the tissue engineering. And I think that is, and even growing with stem cells, that is is that, in your opinion, I guess as your colleagues, is that kind of where CSU research is going? Is that the next frontier? I mean, it's obviously, the final frontier, so to speak, but there's other things going on as well, studying feeding and those kind of things that are kind of treatment. But I guess, is there even any research in actual surgical procedures?
I can't answer that as well.
Or people experimenting?
I think one of our surgeons would probably be better at answering that.
Oh, we'll get on there.
Yes, you should. And I'm sure there's stuff going on there that I don't know about. But to me, it's the tissue engineering is one of the main exciting areas right now.
Okay. Well, let's talk a little bit about what you're doing, which is something we're really excited. You were actually our first grant recipient.
Thank you.
And it's been fun to see your project come on. I know we can't talk in too much depth about it, but we'd love to give an update also to the donors that have given to you.
Yeah. So so one of my passions has been trying to make it easier on some of the most complex children. And the one area that really has become our focus is children with something called hypoplastic left heart syndrome, born with missing half their heart. Through incredible innovations by a number of surgeons, the first being Doyle out of Philadelphia, a lesion that when I was in my training was universally fatal. And the training I got was how to teach a family how to let your child go. Through the innovations of Dr. Norwood and many others, we've developed a surgical series of operations that let these children live. Despite our great improvements, it still carries a lot of stress on the child, and there's a lot of children that don't make it, and a lot of children that when they do make it have a lot of challenges that we still haven't overcome. And so one of my passions and my partners, Dr. Janssen and Dr. Nicholson, is really, can we help these children by trying to avoid the hardest operation in the newborn period? And we're really working on some work done by a group of cardiologists at Columbus Children's Hospital, where they have come up with what they call a hybrid approach, where they work with their surgeon and they try and avoid going on the heart-lung machine as an infant, and that's worked very well in their hands. What we want to do is create a way to palliate this infant without doing any surgery at all. And to do that, we need 2 things. We need to have a special vascular stent or metal framework to keep open a blood vessel, and we need to be able to control blood flow to the lungs. And so through the generous donations of Project Heart and others, as well as some from the NIH, we have developed a vascular stent that is purely designed for the patent ductus arteriosus in children with hypoplastic left heart syndrome and similar lesions. And we are working on what we call vascular resistors, devices that you can put into the arteries to the lungs that will resist flow through the lungs. And the idea being, the dream is this child is born, we let them stabilize over a day or 2, we bring them to our procedure area where we access the vein and arteries in their leg, and we put one stent in the patent ductus, we put a resistor in each artery, we take our tubes out, they go to the floor, they recover, they start to feed, and they go home in a few days. no open heart surgery at that point. And then at 6 months of age, they come back for their first open heart operation, where they're stronger, they're more robust, and
rotund.
Rotund.
Sorry, I just remember Calvin, man. He was like,
rotund.
Chunky.
So the goal is, our dream is to
Right.
take one of the 3 operations out.
See, that's awesome. And that's actually an operation that Calvin went through. And, you know, he had some other issues, so he may or may not have qualified for it. But I'm really excited about this project because one thing I love is that those early days are so detrimental to a child's, and we can get into a whole bunch of host of other things that are not even surgical related or heart related, that are, you know, feeding issues and all these kind of things. But if you could take a child and get them home within a couple of days of being at the hospital, that is why we're so excited to be partnering with you on this.
It'd be a game changer.
Yeah, so it would, and it is, and the other thing is, say we start getting into the realm of tissue engineering and or stem cell growth, you know, growing a heart in a petri dish, so to speak, and if we get to that point, now we can take these kids and let them get more robust, as you say, to be able to handle that transplant or whatever needs to happen. And that's just a big deal, I think. And I think that is something that the general public, that if you're not in this, you just really don't understand how big of a deal that is. And so we're super excited to participate with you on this, and look forward to doing more. And I know we're actually working with you right now to get some more done. And that's really exciting. So let's see. Are there any Facebook questions or anything?
Just your fan club saying how much they love you.
Thank you very much. I might have to get a Facebook page.
That works well.
So, can you talk about where you are now in that research?
So we are, yes, we have, the stent has been designed and is being, and we learned some issues. We designed and built our stent and sent it off to get sterilized and a very specific delivery system, and somehow we had some issues with FedEx. So we're working on the next group of stents, and then we will be implanting them into an animal model to show that it doesn't cause harm. There's no virtual model that will allow us to see how it behaves in a biological system. So we have to use an animal model, and that will be the next step.
So what after that? Say that's a successful step. What are some like the long-term ranges? What time period do you think?
So
best case scenario.
Yeah, unfortunately, it's much longer than anybody would like it to be.
Yeah. Well, this is good because honestly, I think the part of this is to talk about how research is so long-term. Like these and device manufacturing and creation and developing is such a long period, and it's just hard to. And this is kind of it. So we can talk about this.
So once we have kind of proven to ourselves that we have a device that is safe and effective in an animal model, and that in itself will probably take a couple of years because we have to prove it in an adult animal and then try and mimic hypoplastic left heart syndrome and do it in that kind of animal model. And then you work with companies and NIH to get them interested in this as an important medical device. And once you have their interest and you have appropriate funding, you create a national or international trial where children will be enrolled in having it put in what we call an investigational fashion, because you have no long-term data in a human to say that it's effective or doing what you want it to do, even though you believe it is. And then that study would take a number of years, and then you would ideally have the FDA say, yes, this does exactly what we want it to do. We give it its approval, and you can use it anywhere else in the world, which is to me really exciting because we have the challenges of this being born in the United States. You're born, you have access to this medical care, and it's challenging, but there are so many places in the world where the current technology doesn't exist and can't be offered. And this kind of care could take the treatment to even the remotest areas of the world. offer this almost anywhere.
Yeah, that'd be great.
Yeah.
That'd be amazing. So we're looking forward to that. I do remember talking to one of your partners, I think the medical manufacturing partner, but he was trying to throw a ballpark. I was like, how much we got to raise to get this thing going? He said $1 million. So if anyone else there wants to get this thing going, because this will be life-saving and life-changing, we just got to raise $1 million. So we'll be working on
one
that.
check. It will take one check.
One check or two checks, $500,000 each. I mean, there's a lot of different ways we can achieve this.
I do want to say something about that, though. What to me has been so inspiring about this whole project, and for my partners as well, is this money is coming from you guys. It's coming from my patients and their families.
Yeah.
Shout out to Colby Hitchcock, who raised money through his own drive, and
he does it every year. That's awesome.
That money is he donated that to us, and that's going to be part of this next step. And it's when you get money from the government, it's very important, very helpful, but very cold. When you get money from somebody you know and a family you know, then it's personal, and you really your drive is so much more intense when it's personal.
Yeah.
And so it's really made it a very special project for us.
Absolutely. Well, I think that's part of the fun thing about Project Heart and everyone that's here, because honestly, I want to give a shout out to the Hitchcocks as well, because they're an awesome family. And when Erica and I were diagnosed, or Calvin was diagnosed while he was still in the womb, we found out that the Hitchcocks, and so we got connected with them, went to this crazy noisy restaurant. It was a semi-disaster, but it was super encouraging to Erica and I to have that conversation with someone who was so passionate, so involved, and just listening about the blood drive that they do every year. And so you guys are awesome. And honestly, this whole community is awesome. So
it's been unbelievable.
Getting just everyone pulling their resources to be able to do this. So, well, that's all I got. So
one more shout out.
Shoot, yes, it's a shout out
to the Hackett family.
Oh yeah, there you go.
And they're a wonderful family who lost a child to hypoplastic left heart syndrome 16 years ago, and have an incredible community that supports them in their efforts to keep his efforts alive, and they have been incredibly supportive. But I get to go out there every year to their run, their 5K run, and that's about as inspiring thing as you can imagine.
That's awesome.
Being out there with a whole community that comes together for this cause. And so, shout out to you guys.
All right. Well, thank you so much for your time today. And this has been awesome, but we're kind of running out of time. So I just want to thank you, and thank you guys for all tuning in. If you have any more questions or anything, or any ideas for future video casts, drop them down the bottom into the comments, and someone from our team will gather it up, and we'll start putting together what we need to do for the future. So we're super excited about this new program. Thank you for being the first one and for coming out, and thank you guys, and have a great day.